So before entering the room, I'm going to check the patient's medical chart, and it's going to tell me the medications they're on, any allergies they have, their past set of vitals, their past set of labs, their medical diagnosis, any INO they're on, the orders from the doctors. So I'm going to look at all these things. Then I'm going to knock on the door. I'm going to wash my hands. I'm going to introduce myself to the patient. When entering the room, I'm going to note the patient's general appearance, make sure they're not in any signs of acute distress or they're not confused or wearing inappropriate clothing for the time of year it is. Like in the winter, you don't want to see them in any shorts and a tank top. That would be inappropriate. And then I'm going to ask the patient like what his name is, what brought him in today. So hi, I'm Moni. I'm going to be your nurse today. Can you tell me what brought you in today?
Yeah, I am just in for a physical.
Okay, awesome. So then I'm going to go ahead and check his neurological signs and symptoms. So the first thing I'm just going to note is that his verbalizations are clear and understandable, that he's alert, like responsive, like good level of consciousness. And then I'm going to ask him who he is. Can you tell me who you are?
My name's Jacob Hammond.
What brought you in today?
A physical.
And where are you?
The hospital.
And what is the year and the month?
October 2020.
And then next I'm going to check his eyes. So I'm going to check for accommodation. So once the light gets closer to his eyes, his pupils should constrict, which they do. And then I'm going to check for that his pupils are equal, round, and reactive to light. So when one pupil I shine the light in the eye, and I'm going to see the light in the other eye, and they're also both going to constrict at the same time. So now can you look at the light for me? Okay, awesome. So he has all of those things, so that's a good, clear, like neurological assessment. So next I'm going to go into the vital signs. So that's going to be temperature, pulse, respirations, oxygen saturation, blood pressure, and then the sixth vital sign is going to be pain. So are you in any pain today, or would you rate your pain out of 0 out of 10?
0.
Okay, so then I'm going to move on to the chest area. So I'm going to listen to the patient's heart and lungs first. And now can you take a deep breath in and out for me? Again. 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 Can you take it again? Sorry. So the patient has equal breath sounds and he has no murmurs. I'm also going to listen with both the bell and the diaphragm to make sure that there's no murmurs, because the murmurs are heard a little bit better with the bell. I'm going to check to see if he's using any accessory muscles with his breathing. Are you complaining? Do you have any shortness of breath or anything?
No.
Okay, so then I'm also going to check for his carotid arteries, just to make sure there's no bruits, which is going to be listened to with the bell of the stethoscope. And there's no bruits. I'm going to check pulses bilaterally, one at a time. I'm going to also assess for jugular vein distension. So I'll be sitting with the patient sitting there. There should be no anything sticking. No, his jugular vein should not be sticking out of his neck. I'm going to check for CVA tenderness. So I'm just going to lightly hit on the back and ask if he feels any pain. Do you feel any pain when I do that?
No.
Okay. So that's all a good sign. I'm going to check his upper extremity pulses. Awesome. So all of his pulses are going to be 2+, which is considered a normal assessment. So next I'm going to move on to the gastrointestinal. So I'm going to ask the patient, has he been having any trouble with nausea or vomiting?
No.
Have you had any diarrhea?
No.
And when was the date of your last bowel movement?
Yesterday.
So have you experienced any constipation?
No.
So I'm going to have the patient lie flat on his back. So first I'm going to inspect the abdomen and make sure that there's no like distension or ascites. Then next I'm going to listen to the abdomen. So the patient has normal active bowel sounds in all 4 quadrants. So next I'm going to palpate your abdomen lightly. So just tell me if you feel any pain.
No.
Okay, so now I'm going to palpate deeper.
No.
And then I'm going to stick my hand to the abdomen on both sides. And then when I remove it, I'm going to see if he feels any pain. And this is known as like rebound tenderness, which can be a sign of appendicitis.
No.
All right, you can sit back up for me. So next I'm going to move on to the lower extremities. So, do you mind removing your sock? Or just, I'm going to do all extremities. Do you mind removing your socks for me? So I'm going to assess all extremities for edema. So I'm just going to place my finger on it, make sure there's no pitting. Going to do this in the lower extremities. I don't know if you can see with the camera. There's no edema. So I'm going to check his pulses. I already checked his radial pulses. So now I'm going to check his cap refill. So I'm going to squeeze a finger. Another finger. I'm going to check his pulses in the foot. Again, I'll just grab this. I don't know if you can see it. But I'll check his dorsal pedis. Or not, yeah. His posterior tibial. His dorsal pedis. On both feet. I'm going to check the cap refill. It's a little slow, but I think his feet are a little cold because he was outside. So, then I might ask if he has any pain, or numbness in anywhere, tingling.
No.
And then if I had an object, a sharp and a dull one, I'd be asked if he could like tell the difference between what's a sharp pain, what's like a dull pain, what's soft. So next I'm going to check any wounds. The patient doesn't have any wounds, but normally you would check for redness around. That might indicate swelling or infection. And then you'd also check for swelling. You check for the drainage, what type of drainage, did it like have any smell to it, and like what kind of wound care that they were doing for the patient. Then I would move on to the IV sites. I would check the IVs for any infiltration. Make sure they're patent, what's going through the IV, if it's saline locked, that he's not having any reaction, the catheter size, and the gauge. And then I would just wrap up my assessment, ask the patient if he has any questions, wash my hands, and exit the room.